In this final video for the cardiovascular system, I'll talk about homeostatic imbalances, disorders of the cardiovascular system. So, most common type of heart disease in the U.S. is coronary artery disease, leading cause of death for men and women. It's caused by the narrowing and hardening of the coronary arteries. You remember, these are the ones coming off the base of the aorta that supply blood to the heart. Substances such as cholesterol build up inside the arteries, and this buildup is called atherosclerosis. The resulting blood flow is that it's impacted, so there is a lower supply to the heart, and this can lead to a condition called angina, which is chest pain, shortness of breath, and a possible heart attack. Another term for heart attack is myocardial infarction and MI. Risk factors for this disease are age, high blood pressure, high cholesterol, family history, smoking, and obesity. Peripheral arterial disease is similar to coronary artery disease, only the atherosclerosis is building up in peripheral blood vessels, such as those that supply the upper and lower limbs. This will result in poor blood flow to the hands and feet. The risk factors are similar as the ones we saw for CAD and also increase for people who smoke. Often this can be asymptomatic, but symptoms may include heavy feelings in the legs, sore heels, poor, weak pulses in the legs, and bluish skin. You can see by this picture, this is not healthy tissue. The oxygen and waste removal is not happening properly here. Deep vein thrombosis, DVTs, are blood clots located in a deep vein, typically in the legs. It can be harmless and asymptomatic, but if part of this deep vein thrombosis were to break off, this is basically like a blood clot, and travel through the bloodstream, it can get caught somewhere else, like in the lungs, and that would be a pulmonary embolism. Or if it travels to the brain, that would be a brain embolism. That could lead to stroke and death. Symptoms of deep DVT are pain, tenderness, and or swelling in the leg. Risk factors are age, inactivity, injury, pregnancy, and obesity. DVTs can be diagnosed quite simply through ultrasound. Mitral valve prolapse is when you have an insufficiency of the functioning of the bicuspid valve. It's not going to close properly, which can cause blood to regurgitate or leak backward up to the atria through that valve. Many people are asymptomatic, but the following are possible symptoms: coughing, shortness of breath, chest pain, palpitations where it feels like the heart is fluttering. Risk groups are if you have a genetic or family history of this condition, or if you're born with it. It can be detected on auscultation, which means when the heart is listened to with a stethoscope. Often it doesn't require treatment, but it can lead to something called endocarditis, which is a type of heart infection. Hypertension. So hypertension is a very prevalent condition in the United States and globally. It is high blood pressure. So it's defined as blood pressure of 140 systolic over 90 diastolic or higher. This condition is usually asymptomatic but can lead to serious problems such as heart attack, kidney failure, and stroke. Risk factors include age, diets that are high in fat or sodium, obesity, alcohol intake. Some medicines can increase blood pressure, and other conditions such as sleep apnea, thyroid disorders, and diabetes. At the bottom here, you can see how hypertension is categorized, with normal being less than 120 systolic and less than 80 diastolic. There are pre-hypertensive states, which is 120 to 139 systolic or 80 to 89 diastolic. Hypertension stage 1 is 140 to 159 systolic or 90 to 99 diastolic. And hypertension stage 2 would be greater or equal to 160 systolic or greater or equal to 100 diastolic.